So guys, the first peel we have is called a light peel. Hence, it's very gentle and very, very safe to use. Now, May is a darker Fitzpatrick skin type, and I want to show you how safe and easy Filorga is for darker skin types, because people often think, ooh, are we gonna have problems with pigmentation? Let's get the camera on May. Here we go. So what I'm gonna do first and foremost is get my pre-peel. What we've done is we have simply removed all jewelry. Patient's nice and happy, she's consented. She's cleansed her face with a gentle cleanser. And then we have this. Can you see that? Pre-peel. It's a solution that comes in the kit, and I've put a little bit on the gauze there. And we're simply removing any residual makeup still left behind, and also any oil, because we want the peel to penetrate very evenly as we apply it onto the face. So gentle application. By the way, when you use gauze, try to use the soft gauze. So in your clinics, don't buy the rough gauze, buy the soft gauze when you're peeling, because rough gauze, you can almost do a microdermabrasion kind of treatment on it, right? So the peel tends to go a bit deeper. So nice soft gauze, here we go. That's cleansed nicely for us. Now, you can put some eye protection, but I've got to be honest with you, as long as you're nice and careful, Vaseline normally goes on the lips, nasal cavities, but other than that, I'm not too excited. So here we go. This is the light peel that comes in the box. This is the peeling agent, okay? So here we have decanted 3 ml of the product, and it's a liquid solution. It's like a clear solution. So what we're going to do, patient lifts her chin up a little bit, and look what I'm doing here. So I'm taking the brush and I'm gently removing the excess, so I don't want any drippage. And I start at the forehead. We always start our peels at the forehead, and we're gently applying it like so in a systematic fashion into the hairline. Don't worry about the hair follicles, they will not get damaged. So you don't want too much product because you don't want drippage, but you definitely want enough to cover a little bit of a layer throughout. So you turn your patient and then you work systematically on the lateral cheek. So again, you dip, and you want to be a little bit fast at this time, because you want to apply the peel relatively evenly throughout the whole face, so that by the 3 minutes, you can then neutralize everything at the same time. Now let me show you something called feathering. Feathering is when you take a bit of the product and you feather past the point where you're finishing, you see, with a gentler, lighter application, because you don't want to create a demarcation line like that. If you did many peels and you stop there, over time, particularly patients like me, will get a lighter skin color, darker skin color. So you always have to feather or blend it right through. We go around the other side. And again, we work lateral, and then you work your way into the mid-face. But you start with a thicker skin on the periphery, because it gives you an indication of how the skin is working. So feather, 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 feather. I always do the ears as well. There we go. I always blend it into the neck, the décolleté, and the backs of the hands. I try to make sure my peel is a holistic treatment for all of the visible body parts as such. So around the eyes, you keep about a centimeter distance, half a centimeter is fine also. And the last bit is the nose. Here we go, like so, upper lip, and that's it. Any questions at this point? So we've just applied the peel, and now we just have to wait. So if there's any residual product, you go back and you keep reapplying it. So it's just a question of keeping the layers going. Right, now May, out of 10, how much do you feel the tingling? Show us. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1. So the tingling is minimal. We've probably spent about 2 minutes now on this, so that's absolutely fine. Sometimes it's hard to see erythema, the redness that you expect. So you have to rely on levels of comfort or discomfort. In this case, 1 is absolutely fine for me, so I'm happy to keep this for much longer. So on someone like May, she's got nice thicker skin type, I think we can actually get away with maybe even 4 minutes. I sometimes push it past the 3-minute limit. Once you've done that, we're going to have to speed up a little bit. I'm going to show you what I do now. I take this post peel. This is sodium bicarbonate. take some soft gauze, fold it into a square, and you spray that product onto there. I don't like spraying onto patients' faces. I think it feels a bit, ooh. So I spray it like so, saturate that. Okay, if we do one more gauze for me, that'd be super. And then you go from the top, from where you started, gently wiping it off. As you do that, it may get a bit hotter, which is normal, so do not worry. Tell your patients as you're neutralizing, it may get a little bit hotter. So look, nice and systematic. We work all the way around the ears. It tends to pool around this area. So this is the area that often people forget. Patient goes home, it gets peeled a little bit deeper than the rest of the face. So here we are, neutralization in progress. I'll take the second gauze if that's okay. So that's your first peel. Filorga also has a bright peel and a time peel, which are much stronger, but they are still epidermal peels. So once you've done a couple of these, patients want something new, don't they? So that's when you say, let's move on to the bright peel for your pigmentation, and let's move on to the time peel for those fine lines and textural problems. So I tend to mix and match. Sometimes I do the light peel for the first 2 to 3 sessions, and then I start moving on to the bright peel or the time peel, and I still do the neck and the hands with the light peel. So you can mix and match all your products as you go along. So guys, look, that's it. We've neutralized. The peel is now ready to go. If the patient is only coming for this, all you do at this point is SPF and use the Filorga skincare products, and they go home. But I want to show you that it's very safe to combine peels with the actual meso. So today's session is very much focusing about meso. So Filorga is very famous for its product, and I just want to show you what it looks like. This is what Filorga is all about. It's about the meso products called NCTF. And what I've done is I've decanted it into this syringe and needle. Now everything comes in a pack. Let me show you what it looks like. Thank you. This is your pack. And when you open it, you have all your products in there, all your needles, so you do not need to buy anything, okay? It's got the stickers, it's got all the information in this pack. This is your mesotherapy cocktails. So let me show you how to use it. Today, we're going to be doing 2 things. Today is all about biostimulation with the needle and also with the roller. So I'm going to needle certain areas that I think will be important to improve the texturing, and then we're going to roll this product with percutaneous collagen induction. So you're driving that non-cross-linked hyaluronic acid, you're driving all those 59 different vitamins, minerals, amino acids, etc. into the deeper layers of the epidermis. So you get more hydration, okay? So let me show you very quickly how I do it first with the needle. So it's very simple. Who does needle injections with mesotherapy? 2 or 3 people in the audience. These are ever so simple. So let me show you. The needle that comes with this is a 32 gauge Luer lock. So that comes as part of the actual kit. So that's already within the kit. So you don't need to buy it. It's very fine, and it's actually 4 millimeters long. So let me show you. So can you see that? Ever so tiny. So normally, May is in her 30s. Normally I do this treatment for younger patients for prevention and mature patients for rejuvenation. And it's ever so simple. So once you've peeled, the skin is now clean to go. You can follow certain areas where you see the fine lines, or you can do a generalized treatment approach. So let me show you how to do a generalized treatment approach. So this is now me injecting a tiny little bleb. We're probably dermal in all respects. So this is called a microbolus meso technique, and you just go around the whole skin. This is a wonderful treatment for hydration, bringing back the hydration into the skin. So it's very simple. Do any of you do something called nappage? I know some people in France like to do nappage, and it just means you kind of quickly work the skin. I like to do it with a derma roller, and I'll show you how to do it. But this is ultimately what you do. You just work around the skin, and you gently inject something like 0.01, but it's very hard to tell. But you just inject the cocktail back into the skin. Now let me just show you very quickly how I use this with my roller, because that's what people often ask. So it's very simple. All we do thank you, is we're going to get the roller. If you could just hold that for me 2 seconds. There we go. So you take your roller. If you just lift your chin up for me, thank you so much, May. And you're going to be rolling, this is a 0.5 millimeter, so this is epidermal. So you're going to be depositing the product onto the skin like so. And then you're simply rolling that non-cross-linked HA and all those vitamins into the skin surface. So this is called percutaneous collagen induction. So look, you're going to go this way, go back 10 passes horizontally, then you work vertically, so you never drag on the skin. You have to lift the roller every time you change direction. Then you go diagonally, and again the other way diagonally. So you keep doing that. And what is the end point? What are we trying to achieve? With this treatment, you want to see erythema. That's called redness, right? You want to see redness, and ideally with a slightly longer roller and very thin skin. When you see bleeding points, means you're in the dermis. Bleeding points means you're touching the dermis, which is good, because as the needles penetrate into the dermis, we're stimulating cells called fibroblasts. And fibroblasts make what we love, collagen and elastin. So actually, when you do see a little bit of bleeding points, don't worry, that's a really good sign. That means you've gone past the basal membrane and you're going to get that benefit. So I do this treatment on the neck. You can do this on the chest. You can do this on the backs of the hands. Anywhere you see improvement or you want to see improvement in skin quality and skin texture. So this is what Filorga is very famous for, the mesotherapy cocktails. Are there any questions at this point about this treatment? Any questions at all? So once you've done this, May, tell us, how do you feel out of 10? What's the level of discomfort for this treatment? A 1 out of 10. So actually it's very, very, she hasn't had any EMLA. This is purely after the peel, you go straight in and you start doing your mesotherapy. So this is what you do. And can you see, we're accumulating a little bit of erythema this area. Can you see that? So there's slight elements of erythema, which is exactly what I want to see. So how close do you come to the eyes? Well, personally, I work around the bony areas. So you don't want to go too close, but you can work around the areas like so. Obviously, be very, very careful you don't go into the eye itself, but that's absolutely fine. You can work these areas. If you have any acne scarring, I know a lot of my patients do, post-acne scarring is a huge problem, and psychologically it's very traumatic. This is wonderful. This is a really great treatment. I would use the 1 millimeter needle length for your acne scarring, and then roll this in because it's going to hydrate those acne scars. You can also lift the acne scars. Thank you, Rebecca. If you just pop that back into them. You can also lift the acne scars by using your injector needle. So if you find there's a scar, you put your needle and you just inject into it a couple of times to get that little bit of hydration and stimulation within. So we're going to move on to the lips, and I'll finish the rest of the face a little bit later. Are there any questions at this point?
Just one thing.
Yes.
Oh, sorry. Real question first.
Whilst we're doing that, I'll just carry on the other side.
Do you have a preference in terms of
Can I take that
injecting the mesotherapy product or derma rolling it in terms of
What do I prefer?
effect? Yeah.
I love combining them.
Do you?
I do. So I chase the fine lines. I mean, we've got a very young model in this case, so it's not like she needs much wrinkle chasing. But certainly most of my patients will come and say to me, you know what, Dr. Good, I definitely want these certain lines around my eyes or around my mouth treated. And then can we do a general kind of collagen stimulation treatment throughout? So I tend to combine them. And I think that's a nice way of doing it because I don't think many people do that. Not many people combine meso with rollers. But I do think having all those penetrations, if you think about it, we're probably getting over, 125,000 penetrations for the full face. That's quite a lot, and it would be so hard to do that manually by hand. So for me, that would be a little bit of a no-no. But what you can do is you can package this lower face area as biostimulation using meso, collagen, and your fillers. And I'll show you how to do it, because that's a very popular area to do. Most patients, female patients in their 40s, want them lips, don't they? And anything around the lips. So that's a nice little combination treatment to do. Does that answer your question?
It does. Thank you. you.
Any other questions whilst I'm finishing this side?
I was just going to ask about if you're going for pinprick bleeding as an endpoint.
Yes.
Can you achieve that with a 0.5 roller, or do you need the one surely
You
for
know
that?
what? It's funny, skin is so different from person to person. You never quite know. So thinner skin types, even using the one, you're going to be in the dermis. Around the eye, you're probably going to be in the dermis. So I think I'm trying to achieve erythema, and I'm trying to drive that hyaluronic acid and those vitamins into
Sure.
the epidermis
Yeah.
primarily. But if I am seeing that redness and that bleeding points, that's amazing. That means
okay.
I'm getting
Yeah.
extra benefit there for me. So by all means, I'm happy to work with the 1 millimeter all over the face, but just care around the eyes and the neck, because
Sure.
that's slightly thinner body parts compared to the face.
Thank you.
Guys, any other questions? Do I use a meso gun? Who has a meso gun? Oh, you're very lucky. Yes, by all means. You can actually put all of these syringes into the meso gun, and you can do all of that. Which gun do you have? Which one do you like? Oh, this is the James Bond one. Yeah, I like it too, actually. No, that's fine, absolutely fine. And you can gauge how deep you're penetrating with a meso gun, so you have a bit more control. But by all means, you can do that. Any other questions whilst I'm finishing up here? No? Should we work with the fillers now? Let's have a look at how we use the fillers. Thank you, Rebecca. Okay, guys, so what I'm going to do now is I'm going to move on to our fillers. I'm just going to cleanse the lip area, if we can get a few more of these. These are just alcohol wipes. We've numbed the lips, and I'm just going to go around the lips very gently. Now, May said to me, please don't do too much. And I said, that's absolutely fine. Today is all about gentle rejuvenation, primarily with your mesotherapy and your fillers as a combination approach. So here we go. We're cleaning the area nice and thoroughly. And I'm going to show you how I do it with needles and cannulas. Okay, so I'm going to show you two techniques because I want you to see what we do and what we talk about in the book we published on fillers. So that's all nice and clean. Thank you so much. We're going to go on to fine lines. Now, ideally, fine lines will be with someone who's a bit more mature, who's got a bit of perioral wrinkles. But I will show you how nice it is as a contouring agent. Do you mind showing that pack in front of the camera for me whilst I'm getting the needle? Thank you. Right, this is called fine lines. This is the most gentlest filler within the Filorga range. Now, here it is. Let me just show you. I'm not going to inject just now. I'm just going to drop it onto the skin to show you how easily it flows. So this is the product, and look at this. Can you see that? It's a really, really soft product. This is hyaluronic acid, cross-linked 20 milligrams per ml. So it's a very soft gel. You can see that. It doesn't give too much volume or G prime. We don't want that. We just want a very gentle rejuvenation approach. So this is something I would work around the lips. I'm just going to show you some gentle injections. It's not going to do any harm to me, but certainly if she had fine lines around the lips, can we get the camera zoomed in? May, if you just bring your chin down for me. That's it. No, go. Tell you what, can we sit May up? Would that be all right? Can somebody give us a hand setting May up? She might find it. Oh, there we go. Even better. We'll go right nice and vertical. Guys, can you see better like that? Is that better? Hey, can you see the erythema there? Look, 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 look. That's a really good endpoint. So you see, I haven't done enough on the forehead, so we probably need to go back and do a bit more there. Okay, so what we normally would do is I'm going to show you on the skin what I would do for somebody with perioral wrinkles. So look, you see these little blobs I'm doing on the skin? Can you see those? That's what I would deliver into the dermis. Hello, my friend, how are you? May doesn't have those. Give us a pout. We can begin to predict in most patients, but not in May, where they would come. So she's perfect. So what I'm going to show you instead is how to do the vermilion border with the needle, because I do think the minute you put filler in the vermilion border, you create a beautiful contour. And contour means definition, and definition means nice, elegant-looking lips. So it's not all about volume. I really believe in that contour and the shape of the lips. So I'll show you how to use this needle. And all I'm going to do is this. I'm going to go and roll it all the way back along the vermilion border like so. You ready? Who does this treatment? Do you do this treatment a lot? It's very, very easy. Rebecca, do you mind if I just have a quick look? Sorry, I'm just going to see what everyone can see. So look, I'm putting a blob at the Cupid's bow, so I now know how to measure my needle. So I start through here, deep breath in for me, May, and look, I'm pulling the needle all the way through to the Cupid's crest. At the top, you can aspirate, but there are usually no vessels in this area, so there's probably not much need in doing so. And so now all I'm doing is I'm gently pushing the product out, just to give a little bit more contour. And she said to me, please don't put too much. So we're doing very little today, but you can push much more product if you wanted to. So what you do then is you connect it, open gently for me. Open gently your mouth, that's it. You connect it through to the second point. You work right up to that point you finished, okay? And then you gently press the plunger and deliver your retrograde thread or filler. That's how easy it is. How much volume you put depends on what your patient wants. Today, the request is absolute minimum, so I'm not going to be doing too much rejuvenation here. Sorry, too much augmentation. Let me show you how to do Cupid's bow. It's very simple. So this is the crest. This is the bottom of the Cupid's bow. So you stretch the skin, open your mouth gently for me, and you move the needle in through here, up to the crest. Don't go into the white body of the lip. And you simply push the plunger and retrograde thread this way for me also. So again, very, very simple treatment. It depends on how much product you want to put. Let me go around this side. Okay, let's go. So, Cupid's crest, measure the needle length, and here we go, in. It's a little bit nippy around this way. May, how are you feeling? Thumbs up or thumbs down? Thumbs up. Well done, you. Okay, and retrograde thread. Open gently for me again. And in again. Connect those two. And then retrograde thread. Oh, there's a little tear coming through. What do we do for beauty these days, huh, May? Oh, well, thank you so much. Appreciate that. Okay. So it's a little bit nippy. Us ladies know that, don't we? Oh, yeah. It's a little bit nippy around the lips. But it's worth it. So here we go. Again, bottom of Cupid's bow, up to the crest. Don't go any higher than that. And retrograde injection. So when we do the lips, I love doing cannulas for the body, and I'll tell you why. There's a publication that came out in the PRS, I think only a few months ago, by Sebastian Cotofana. You know that one. Mm-hmm. And this publication showed us cadaveric dissections. Over 100 cadavers were dissected for their lips. And they were looking at, if you could just press that for me for 2 seconds on there for me, Rebecca, thank you. Just nice and. They noticed that most of the vessels, the artery, the superior and inferior labial artery of the lip, most of it is behind the muscle. So if you put your tongue like this, you should feel it just behind the mucosa. But they also found some of the arteries were actually within the muscle, so closer to the outside of the lips. Does that make sense? And they also found in some cases it was in front of the muscle. So for me these days, I tend to use a lot more cannulas when I treat the body of the lip, because if you think about it, when you put a needle, it's sometimes hard to gauge how deep you are. So that's just something for us to consider. Okay guys, so once we've done that, we can work the lower lip if you feel there's a need for contour. So, let me show you what I do on the lower lip. Turn for me this way. How are you doing, May? Good job. All right, so open gently for me. Now, in most cases, on young patients, I would use the lip one alone for the contour, because young patients can take a bit more contouring. Mature patients, I tend to use fine lines because it gives you much more of a gentler rejuvenation approach. So I tend to lift the corners up, open gently for me, and what I will do now is I'm going to put a thread like so. Why am I putting it past the lip into the white lip? I think it creates a bit of tension. Do you agree sometimes? And it tends to lift the corner of the lip up. When the lip corners are up, people look a lot happier. So it's not just about volumes, isn't that right? It's not just about a pout. It's about those corners being upwards, because people then look positive and happy. So I always try to combine the corner with the vermilion border. So here we go. In, open gently for me. Open as much as you can. And into the white lip. I tend to aspirate at this point. And then we pull out. Aspiration isn't always a positive indicator, but I've seen far too many whilst teaching aspiration. So I think it's sometimes good to do. So once you've done that, You can continue. Open gently for me, darling. That's it. You finished around here, so you can continue your vermilion border treatment. Here we go. Now, something I see a lot, and I don't know what you think about this, I see a lot of so-called vermilion border treatments done too high or too low. Does that make sense? So, for example, if you put filler here, look here, in the white lip, that's not a vermilion border treatment. That's going to volumize the white lip and give a bit of that kind of look. I don't think it's attractive. If you put it too high up, if you put it here, in there, well, that's going to help with the fine lines, but actually that's not a contouring treatment. That's more of a volumizing treatment. So it's really important to be able to actually target that injection exactly where you need to be. Now, she's got quite a lot of volume through here, so you may not want to put too much of a contour on the lower lip and just go on to the other side, and that's absolutely fine. So let's have a look. Open gently for me, May. Thank you so much. And again, in, and we pull through, pass into the white lip. You can aspirate, although that's not always positive, but sometimes it's worth doing just to double check. And a retrograde thread all the way back. Done. And final one through here. The needle's getting a little bit blunt, so at this point I probably would change the needle, but we're almost finished, so we might as well just do the last treatment. And that's it. So what have we done so far? You can use either fine lines for a gentle lift, or you can use the lip one for a bit more oomph. And all we've done so far is just given an elegant little contour. It's not volume, it's just sharpening the way the light falls onto the skin, and that's elegant sometimes. So, for some people that may be enough. May, if you just put your head down for me, like so. That. So can you see it's just a little bit sharper, but we're not doing too much here. So now I want to show you what you can do for lip volumization, but again, she doesn't want too much, so I promised her I won't put too much product in today. So let's go. Can I get so I'll give you that now. I'm going to now move on to my cannula treatment. So let me show you how I tend to do that. Can we show the art filler lips if that's okay? Thank you so much. So this is the filler we're using, 25 milligrams of hyaluronic acid, cross-linked. Okay, and what I'm doing now is I'm putting that filler into a cannula. Now, the size of the cannula is really up to you. It depends what you have as well. So you can use something like 25 gauge. Sometimes people use 23 gauges. 25 is usually fine, but today we have this one. This is a 23 gauge, 3 centimeter long. So we're going to do what we have. And then we have an introducer needle. This creates the hole for the cannula to go into. This is usually a larger needle size than this size because you want it to be nice and easy. So let me show you how I do it. Would you mind holding that for me? That's okay. And we'll work a little bit together. So what I'm doing now is I'm going to make some entry points. Very, very simple. Open gently for me. So the first entry point is going to be around here. And look, in, and that's it. I tend to leave the needle in. Don't rush in and out. Otherwise, sometimes you don't open the hole enough. So once you've done that, I tend to rotate. Get my tunnel ready for my cannula. You want to get the tunnel ready for your cannula. And then open gently again. I do a second one down below usually because I do find it's easier to get into, but you can go through one hole if you want to. Leave it in, rotate. Don't rush these treatments. Lips are very painful, sensitive areas. We know that, don't we? So we have to be a little bit slower with our injections. Thank you. I'm just going to cap that here so it's ready to go for the other side. Okay. Have I got my filler? Ah, super duper. Thank you very much. Okay, guys, let's go. So let me show you very quickly. This is the cannula. Let me show you where the entrance is. Can you see that product being pushed out? And let me show you how quickly that comes out. You see? Very easy. And this product is very, very soft. So you don't want too much G prime. I don't like lips which are too like that and too hard. We want to have kissable lips, right? We want to have soft lips. We want them to replicate what we normally have, right? We don't want too much hardness in the lips. So I love soft products for my lips. So once you've done that, I'm just going to get new gauze if that's okay. May, how are you feeling so far? thumbs up, yeah? Oh, that's good. Thank you. That's lovely. I'm just going to get one gauze. That's plenty for me. Thank you, my dear. That's right. Good. Okay. So, cannulas. Who uses cannulas in the room? Let's have a look. 5 minutes is plenty for me. 1, 2, 3, 4 people. Guys, please go and buy some cannulas. I'm not promoting any brand. I'm using Soft Fill. You've got TSK. There's a lot of other brands out there, but these are the ones you have to use cannulas. They're absolutely phenomenal. You get much better treatment, I think, at least, for larger surface areas. Open gently for me, May. Open nice and wide for me. Let your jaw drop right to the bottom. So look, I want to move that cannula up to the Cupid's bow. Okay, so what I'm going to do is I'm going to find my entry point, which is somewhere around here, and this is the part which we all know takes much longer time than actually doing the treatment. It's finding that entry point, and here it is. Once you're in, can you see what I'm doing now? I'm not shoving it in because you don't want to be too traumatic with the lips, because there are vessels in there, so you're going to be rotating ever so gently like so. Deep breaths for me, shoulders right down, and you take your time. Cannulas are opening the tissue planes. We don't want to be rough with them. The gentler you are, the less swelling. I really believe that. Open right up for me, that's wonderful. And so what we're doing is we want to be nice and deep, not too superficial. So you see that? I'm feeling the tip of that cannula, and now we're right at the top. So here we go. Right to the top there. Can you see that, guys? And what we're going to do now is we're just going to pull back. So at the moment, it's at 0.85. So maybe we'll put 0.1 or 0.2 cc into the upper lip, just to get that really gentle rejuvenation approach. But we don't want to be doing too much product, because May said to me, I want a very gentle rejuvenation approach. So here we go. Guys, I haven't put too much product, and we'll definitely mold it in a second. But May, could you sit up for us for a second, just so we can have a look? So all we've done so far, we haven't changed the lip structure too much, but you can see, as she turns her head from side to side, there's actually just that little bit more volume in the lips. Can you see that compared to the other side? I know the lighting is not great in this room. Here we go. It's just a little bit more volume. And that's what we're chasing. We don't want too much like that. The lower lip in May is actually quite full, isn't it? But it is a little bit dry, and there's a few fine lines coming in. So you can put this in to get more hydration into the lips. But actually, I think we need to rebalance the lips and put a little bit more volume in the upper lip. What do you think? Who's up for more volume in the upper lip? Lift your hands up. Who says no more in the upper lip? Lift your hands up. No, don't do that. 50-50 in the room. Personally, I think she can do with a little bit more, but let me do the other side and see what we get, shall we? Let's have a look. So far, have you found this to be an easy approach? I remember the days when I used to stab my patients a couple of times with my needles for lips, and there was a lot of bleeding, and there was a lot of holding, and a lot of tamponading. It's easy with cannulas. When you go from the white lip and you gently screw it in, you are basically kind of twiddling it in. It's a much more elegant treatment, I think, and you get much more natural results, in my opinion. But everyone's different, and everyone's entitled to it. So let me show you this side. May, you'll be very happy, honestly. It's exactly what you wanted. Very, very elegant and very slight improvement. So here you go. Leave it in. I'll take the cannula now. That's okay. Thank you so much. No, let me help you. I don't want to get you injured with that needle. Sorry. Guys, are there any questions at the moment whilst I'm doing the other side? Is it all clear where we use the fine lines and when we use the lip product? Easy peasy? Okay, so open gently for me. So again, we find our entry point, which takes a lot of time usually. There we go. Come on, in. No. And we're in. So once you're in, again, gently, slowly rotate. Take your time, don't rush it. Alice, how are we doing for time? We're short of time. A couple of minutes, okay. So perhaps if we can field some questions at this point, and I'm really happy to wrap it up.
I feel you've explained everything so well as you go along. There's a few things left to ask.
No, that's absolutely fine.
But I think we're all looking forward to seeing the final results of
Of the lips.
Because we know May was anxious about not going for more lips. I think that's why we were all downvoting it, saying.
Exactly.
But I bet they're going to look great.
Exactly. No,
And
but
there's
this is...
hardly any redness on the face now, is there, from where you did the needling earlier? That's all calmed down.
I mean, people
Just a
can actually go
little bit
out
round
now,
here.
can't they? As long as you give it another couple of hours, you can go out, have a nice party, perhaps no alcohol tonight, but actually this is a very simple combination approach today, isn't it? So let's have a quick look. Now, this is when I'm a bit of a perfectionist when it comes to lips. And I book my lip treatments for, honestly, for 45 minutes to an hour. I don't like to rush lips. So normally what I would do is I would go back in, go out, go back in, get the patient to have a look in the mirror. Lips for me take time because they're such an important part of the face and they're so sensual, so you can't rush them. So we may put more, we may stop now. Let's have a look. If you sit up for me, May, we'll have a quick look. Sit up for us. Guys, what do you think? Does she need a bit more perhaps, or a bit more correction, or a bit more symmetry? Oh, that's a nice smile, thank you. So it wasn't so
that's
bad
lovely.
after all, was it? Okay, do you think she needs more product? I think she needs a little bit more on the upper lip perhaps. Do you think, can you see the improvement in the volume? Interestingly enough, I really believe that when you put products like these in tissues, particularly like lips, which are dry, it creates a really smooth surface. Have you noticed that after fillers? Patients often say, oh my gosh, my tissues feel better. They feel a lot softer and smoother. So it stops the cracking of the lips. So look, this is a really simple treatment. What I would recommend for May in the future is the following. So you see her chin. Who thinks they would want to do something with May's chin? Yes. What can we do in this area? Because lips need space. We don't want to crap them up and we don't want the chin riding up too much. Do you think there is scope? She's got quite an active mentalis and you see that it will dip through here. Do you think she could benefit from a little bit more work around this area, the perioral area? Maybe a little bit, just to keep that nice and elongated. What about the lateral zygoma? Would anyone do anything on the lateral zygoma? So let's have a look at her OG curve. Can you see there? Sorry, hang on. This way. More, bit more. So you see this point here?
Juliana,
I think that point needs to be lifted a bit, okay? Because once you lift this area, let me just show you something. Thank you, Rebecca.
we have got to stop.
Once you lift that area up, all of this tissue here will lift up also. So I would recommend this, a little bit of volume around here to elongate this and keep this nice and open. And other than that, keep up the meso, keep up the percutaneous collagen, the fillers, and the peels. Thank you.